Hello everyone, I am Dr. Sushruth, Managing Partner, Medical Ins LLP, and we have very important product that is called as Civilex. Civilex is online homeopathic medicine search engine. It's an online based web search where you don't have to have any repertory done for any particular cases. Directly type the symptom as per the patient narration and you will get the drugs. As of now, we have added Materia Medica Pura, chronic diseases, all both 2 volumes, and Boger, Synaptic, Boric, Materia Medica. And in future, it's in the pipeline where Harry 10 volumes and then 10 volumes will be added. Now, through Civilex, I'll be training on particular aspects of classical homeopathy, which is defined by Dr. Hahnemann. We have a great respect towards Dr. Hahnemann and the way he has invented homeopathy science, medical science. Okay, so now let us understand there are very important books that we have to consider when we are practicing classical homeopathy. First is Materia Medica Pura, which is of 2 volumes. Lesser writing by Hahnemann, and Chronic Diseases 2 volume. Organon of Medicine 6th edition, where he will be focusing more on 0 bar 1 potency, that is 50 millisiemal potencies. Now let us understand how he found that there is a miasm which is called Sora. There is a miasm which is called Sora, which is major cause of current illnesses, even in the past data also. And how he found out that there are anti-soric medicines also in the available resources. And let us understand at what juncture he has found out Sora. So when during his course of, now I am going to take an initial introductory part of chronic diseases. Once this is done, I will be talking about further lectures on symptoms of latent Sora, primary Sora, secondary Sora, and try to cover a couple of the drugs also. So this journey continues. This is the first day of the journey. Okay. So now introduction to chronic disease. What has happened? First of all, let us understand that let's do not compare with the other system of medicines. That is not what we have to do. We have to understand and learn how our system is. Forget about other systems. So consider that we are superior. Do not ever try to compare with other systems. Every system has its own pros and cons, and every system has its own benefits, which we have to avail wherever it is needed. But as of now, let's talk about only homeopathy. So during the time, there were like very good cases taken care, especially there has to be a good cure which used to happen in all cases, especially acute cases, epidemic cases, sporadic cases, even venereal diseases also. Even venereal disease also, homeopathic doctors used to cure from the root cause itself, like venereal miasms. But whether it's a psychosis or syphilis. But what has happened is, during those courses, these I would say acute epidemics, sporadic and venereal diseases, the same low dose, minimum potency, whatever he has explained in 6th edition of Organon, everything was possible, and everything was acceptable by every clinicians of those days. But it used to be very economical treatment also. With a small dose, they used to get very good success. What has happened is, during these courses, when they were treating acute diseases, epidemic diseases, there used to be certain cases or relapses or a residual symptoms used to remain there. So those residual symptoms, say for example, acute case comes in and then we treat it completely, and during the change of weather, I would say stress or a strain or any kind of environmental change, whether it's from rainy to sun or sunny to winter, during those seasons what used to happen is again those diseases used to come out. So now what he thought is there has to be something else beyond this. So now why acute diseases are getting cured, which are non-venereal acute diseases, and they are getting certain problems in certain cases which are of a larger number, which still existing, which those days clinicians were not able to cure it. Now, what are those diseases? So now Dr. Hahnemann thought so many times like these are the diseases where we are not able to achieve even with a minimal dose, well selected homeopathic remedy. So now what has happened? That particular incident where he felt that there is a deep-seated some kind of issue. Okay, so that is what his mind got stuck, and then he worked on that particular deep-seated problem, and then and tried to sort it out. Now that is what a deep-seated problem which got him to find the Sora. Now, whenever they were doing acute diseases which are of non-venereal diseases, what used to happen is there used to be a good beginning. I have written here there used to be a good beginning, and but the more you start treating those acute diseases which were like chronic in nature, later stage, so those were with a less favorable. Progress was less favorable, and later on the outcome was not what he desired. Okay, so these are all the areas where, and what you call as an obstacle to cure. Obstacle to cure is like whenever you have certain things, you have cured it, and then later on you find that again it's coming back. If it is coming back, then it is in more violent stage with the same selected medicine. Say for example, for acute cases where you have selected X medicine, okay, so you have selected aconite or belladonna or astaxanthin, any medicine you have selected. Later on, what used to happen? Cure used to happen, but whenever there is an obstacle, like your change of weather or any external impressions that used to stress that particular patient, or any external ailment, okay, for that matter, or a food change or a routine habitual change, those all used to again bring back the original disease, and this time even well selected medicine used to fail. Now why it is happening? That's what struck Dr. Hahnemann's mind, and then lead to a invention of Sora, which is called as the mother of all chronic non-venereal diseases. So now, what is that main important aspect? Sora is mainly defined by H. Okay, so in all these cases, whichever cases were giving a difficulty in proper cure or giving a proper outcome, they have tracked the history. And now in entire history, there used to be one symptom which every patient missed. That is itch. Whether it's a pustule or it is a herpes infection, any kind of skin eruptions which they missed during the case taking, and when they went back and then asked all these difficult cases, there used to be one part which everybody noticed and everybody missed. The statistic says that everywhere there are issues with the itch. Now that is what led him to understand that itch is the main presentation, exterior presentation of this particular non-venereal chronic diseases. So now the internal issue came up as an itch. Okay. Now when you suppress it, leads to a latent and secondary issues. That is latent and secondary symptoms. Now we'll talk about it at a later stage. Now let's categorize into this particular slide. Internal issue presented to the local manifestation. How? Itch, that is Sora. Internal itch. Venereal chancre, syphilis. Figwarts, psychosis. Now these are the three miasms which are currently act as a main causative agent for all sort of diseases that are happening along with your lifestyle issues. So now itching, Sora, venereal chancre, syphilis and figwarts. Entire write-ups of initial introduction to chronic disease mainly covers on how he found out why other diseases he was able to cure, but why certain or a major portion of the diseases he was not. Because the main causative factor was totally different, and there used to be a very good cure for syphilis, psychosis and all kind of acute diseases. Even the sporadic as well as epidemic cases, he used to get results, including all his colleagues who were all homeopathic physicians at that time. Okay, but only one set of diseases which were major portion he was not able to address. That is SORA. That is SORA. So that leads to invention of SORA. Initial all around 4 to 5 or 6 pages, whatever there in the initial introduction part of the chronic diseases is mainly about this particular slide. So you have to just remember what is the nutshell, that is what is that he wanted to communicate. He wanted to communicate that even if you change your lifestyle, even if you change your routine, that used to come up again, that disease used to come up again. Maybe patient was very happy for certain days, again those issues used to come up, and maybe patient used to ignore those symptoms because he was tired of those symptoms, and then again move on. But it is not a complete cure. That is why a SORA comes in play. Okay, so now this is what entire thing, and I'm going to posting it to a Similex YouTube channel. You can go there, and if any query comes in about this particular page, then you can let me know. I'll read it and again address it. Now further session we're going to talk about the same introduction to chronic diseases. Moving ahead, a lot of subjects will come in terms of the primary SORA, latent SORA, secondary SORA. If you complete SORA, then consider that your 90-95% of the cases are done. So you have to understand SORA. Okay? Thank you very much, and keep watching the channel. And keep using Similex. Similex completely bypasses you from the repertory, and you don't have to convert all your symptoms into a rubric. Directly enter whatever patient says. And I'll take independent session on the Similex software, how it works. Now in Similex, you just have to type patient coming with a knee pain aggravated by walk, or headache aggravated during the morning hours, start from morning till the afternoon. You just have to type whatever patient narrates, and these 4 books, I would say, chronic diseases 2 volume, maternal medical cure 2 volume, lesser writing 1 volume, and Hahnemann's lesser writing, and along with that Organon 6th edition. These are very, very important books for all classical homeopathy practitioners who want to follow as per Dr. Hahnemann. So please do follow the channel. I'll go in detail about a classical homeopathy system, and I'm sure you're going to get a lot of good results out of this classical homeopathy. Thank you very much, everyone.